Hello, friends. An urban way of living. It has many facilities, some disadvantages also. In urban life, you are more exposed to stress and strain in your everyday life. You are more exposed to pollution in terms of environment, in terms of food. The challenges in front of you are more. The life for you moves faster than others. In addition to this, there is an advantage also, that is the healthcare sector, which is quite developed. Sophisticated tools are readily available in the urban area, so complex to complex diseases can be diagnosed within few hours. For doing an MRI scan, you don't have to travel hundreds of kilometers. The healthcare professionals are available plentifully in number, keeping aside the quality of service they provide. So, despite of having a developed healthcare sector, if anyone asks you what is the state of your health when you are living in the urban area, you will say it's not satisfactory. Why is it so? Because health comes always riding on a bicycle, somewhat like this. The one wheel is the medicine, that is the proper treatment of your ailments. Number two is the proper lifestyle, the food and exercise, etc. If there is a perfect balance between these two wheels, then the health comes to you with a smiley face. So, where we went wrong? When we talk about the modern lifestyle diseases, which has by and large covered most of the people, why it has happened, where we went wrong. Let us discuss about the medicine, the treatment. For example, a patient of cholesterol. So when he comes to us, we say, what is your problem? He says, I have a gastric problem, indigestion, weak digestion, all that. Okay, are you under any medication for a long time? He says, yes, I am taking cholesterol tablets for last 15 years. Okay, for last 15 years, then how is the cholesterol now? He says, well, I cannot say how is it, whether it has gone or not, because it keeps coming up, keeps coming down, like that it happens. But more or less, you can say it is controlled. He says it is controlled, it is not cured. So after 15 years of the medication, what is your situation? If you carefully see, in this situation, neither you are free from the disease, the cholesterol, what you started 15 years back, nor you are free from the medicine, because you cannot leave the medicine now after 15 years abruptly, because you know well, if you leave this medicine after taking it for years, then the problem will definitely go up. So now your dependency is doubled. Is this position better than what you had 15 years back, or it is worse? Definitely will say it is worse than before. So it's very important to know which kind of treatment is suitable for which kind of disease. Coming to the lifestyle diseases of cholesterol, blood pressure, cardiac problem, hypothyroidism, diabetes, etc. What is the right approach to treat all these diseases? How we can know that which treatment is correct for us? Simplified way, I have brought 2 points to know whether the approach of treatment is accurate for you or not. Number one, if you are taking medicine for any kind of disease, as a after effect, it should not give rise to another new disease. Number two, no medicine should make you a lifelong dependent on it. If you are getting, it should not give rise to a new disease. As you know, if you take the conventional medicine for gastric problem, It may bring constipation. If you take medicine for ulcerative colitis, it may produce piles. If you take medicine for anxiety, it may produce sleeplessness. If you take anti-allergens for a long time, it may produce dryness of the throat leading to the sinus infection, etc. If you take medicine for loose motion, the constipation are likely to come. If you take medicine for a long time for thyroid problem, then the after effect may be the frequent cough, cold, etc. So any medicine, if you see after taking that medicine a new problem is arised, then better to stop it there, because this is not accurate. Second thing, medicine is not a thing to take throughout our life. It is only for the ailments. When the ailment is cured, just to stop it. Now coming to the next point. Statins for cholesterol. These are the commonly used medicines in the allopathic system. For diabetes, insulin is being given. For thyroid, L-troxin or Thyronum, etc. are being given. So the layman who follows such treatment, he becomes happy when he see the numbers in the blood parameter coming down. Oh, after taking statin, the cholesterol has come down. Yeah, I have been injecting insulin every day. That is why sugar is coming lower. I have been taking L-troxin every day morning in the empty stomach for thyroid. That is why it is the TSH is showing low in my blood. So they become happy. Just you think for a while, is it you have cured the disease, or it is just a smoky screen that is being put between you and your disease? How? Let us understand. Cholesterol. Cholesterol is a very important nutrient for our body. So when you take statins for cholesterol, straightway it will go and it will stop release of cholesterol, production of the cholesterol by the liver. Liver produces cholesterol in our body, so straightway it will stop the production of production of cholesterol in the liver. Now because of this, the other works where the cholesterol is required gets affected. Cholesterol is required, for example, the each and every cell of our body, they have a cell membrane that is made up of cholesterol, that needs cholesterol. If there is no cholesterol, then the destructure will happen. The cell membranes become prone to damage. Number two, for secretion of bile acid is required for digestion. We need cholesterol. The production of various hormones, the stress hormones, adrenal hormones, the men and female hormones, then the vitamin D production, which is essential for calcium metabolism. All these works, we need cholesterol. These are the few of the things I have explained here. There are many more works of the cholesterol. So cholesterol is essential for our body. If completely it stops cholesterol production, then what will happen about these works? That is why 80% of the people who take statins for cholesterol, they withdraw within 2 years of their treatment, because of its side effects. The muscular fatigue comes because the muscle cells gets damaged. The nervous syndrome start because the hormonal imbalance take place. Likewise, many side effects start. You may get a lowered cholesterol level in the blood. That may make you happy, but you must know behind the screen what is the fact. Similarly, insulin for diabetes. If there is a defect in the pancreas, the beta cells are not able to produce insulin, then what you do, you inject from outside. There is something insufficient at home, so you have brought it from outside. Regularly you are bringing and using it. You cannot say that our home is capable of producing that. So cure is that where yourself, your body is capable of producing that, and normal functioning of the organs start. That is called cure. The same case for L-troxin, the Thyronorm, etc. The doctor give for thyroid. Yes, hypothyroidism, the thyroid level is TSH is high, thyroid stimulating hormone is more because you have less thyroid in your body. So keep taking the thyroid tablets every day. People also become happy. Oh, my thyroid level is coming down when I check the blood. But is it really curing it? Or you are just becoming happy because the supply has been regular to the deficiency? Why thyroid happens? The hypothyroidism happens because excessive stimulation of thyroid stimulating hormone. Why does that happen? That again happens because of excessive stimulation of the anterior pituitary gland of the brain, which has happened due to the excessive stimulation of hypothalamus of brain, which has again happened because of excess stress and strain that the person is exposed to. There lie the cause. If we can make the person tolerant or cope up with the stress, if the body immunity is increased up to that level where he can cope up with the stress of everyday life, then only it can be cured off. So that is why it's just a smoky screen if you are taking conventional treatment for such lifestyle diseases. Homeopathy is such a system which very well stands equal to these two conditions. It never give rise to another new disease. Because of medicine, you do not get a new affection. Number two, no homeopathy doctor gives you a prescription to take the medicine for the lifelong. It has no side effect. It removes the disease from the root. No lifetime use. And the most important is why it is capable of all this? Because it has the holistic approach. Holistic approach, what is it? It means the patient is considered as a whole. When you go with with one or two complaints to the homeopathy doctor, say hypothyroidism. Now, hypothyroidism, yes, we have found the cause increased stress and strain because the immunity has also gone down. Now, because of this increased stress and strain, any other system is affected or only the thyroid system is affected? When you inquire further, you say, no, I have got a skin problem also. I have got a dry skin and repeatedly I get eczematic eruptions. So it has affected the skin also. Then any other problem you have? Yes, I do catch cold frequently. I get sinus infection, nasal blockage, heaviness of the head, all that also. So that is another system, that is the sinus respiratory system is affected. So when you inquire as a whole, what is your problem? He says, I have thyroid problem, glandular system, I have skin problem, I have got again the respiratory problem. So these three systems as a whole are being expressed by your body as an imbalanced state or the state of disease or the state where the immunity has gone down. If the immunity has gone down, it has got reflected in many systems, and all these systems are put together, and when the prescription is made on this whole feature, then this is called holistic approach. When we prescribe medicine on this holistic approach, it takes away the disease permanently. Now coming to the front wheel of this cycle, that is the lifestyle. Lifestyle includes food and exercise. These things already you know how much of which kind of food we should eat, what kind of food we should eat, and how much exercise we should do. 5 days a week we should do the exercise minimum. Food should be always easy to digest, free from oil, all that you know. But the important thing here I want to make is that how much oil you should take in a day. So we can suggest you in the simple way that 10 ml of oil per day per individual is the safe level. Further, if you little bit I will give you relaxation, we can say 500 ml of oil in a day per individual. Per individual, 500 ml of oil can be used. That is the highest level. Beyond that, if you are taking, then it will affect your all the organs. Further, if you want further details, please log on to my website drmeeta.com. In the YouTube also you can see my channel Dr. Meeta Homeopath. In the Facebook also I have got Dr. Meeta Clinic, the URL. There also you can keep yourself updated about the various health problems. With this I remain. Thank you so much. Thank you for listening to me.